Climate change is a global phenomenon that is caused by human activities, primarily the burning of fossil fuels and deforestation. The Earth's temperature has increased by approximately 1.2 degrees Celsius since the pre-industrial era, and it is expected to continue to rise if no action is taken. This increase in temperature is causing a wide range of physical and environmental changes, including melting glaciers, rising sea levels, and more frequent and intense weather events. These changes have significant implications for human health, both in the short and long term. The physical health impacts of climate change are diverse and wide-ranging. Increased heat waves are one of the most noticeable impacts of climate change. Prolonged exposure to extreme heat can cause dehydration, heat exhaustion, and heat stroke, leading to hospitalization and even death. Children, the elderly, and people with chronic health conditions are particularly vulnerable to the effects of extreme heat. Air pollution is another significant health impact of climate change. Higher temperatures and increased humidity can exacerbate air pollution, leading to respiratory issues such as asthma and chronic obstructive pulmonary disease, COPD. Air pollution can also contribute to cardiovascular disease and premature death. Climate change is also impacting the spread of disease. Changes in weather patterns and the distribution of disease-carrying insects and animals are leading to the spread of diseases such as Lyme disease, dengue fever, and malaria. Additionally, climate change is impacting the quality and availability of water, leading to increased waterborne illnesses such as cholera and dysentery. The mental health impacts of climate change are also significant. The trauma and stress caused by extreme weather events such as floods, hurricanes, and wildfires can have a lasting impact on mental health, leading to increased rates of anxiety, depression, and post-traumatic stress disorder, PTSD. The loss of homes, communities, and ways of life due to climate change can lead to a sense of hopelessness and despair, leading to an increased risk of suicide and other mental health conditions. Certain populations are particularly vulnerable to the health impacts of climate change. These populations include the elderly, children, and people living in poverty. Additionally, people living in coastal areas and low-lying regions are at increased risk of flooding and other extreme weather events. Indigenous communities and people in developing countries are also particularly vulnerable to the health impacts of climate change, as they often lack access to adequate healthcare and resources. Addressing the health impacts of climate change requires a multifaceted approach that includes both mitigation and adaptation strategies. Mitigation strategies aim to reduce greenhouse gas emissions and slow the pace of climate change, while adaptation strategies aim to help communities and individuals cope with the impacts of climate change. Mitigation strategies include transitioning to renewable energy sources, increasing energy efficiency, and reducing emissions from transportation and agriculture. Adaptation strategies include improving infrastructure to withstand extreme weather events, enhancing public health systems to respond to climate-related health impacts, and developing early warning systems to prepare for extreme weather events. Individuals can also take steps to reduce their own carbon footprint and support efforts to address climate change. These steps include reducing energy use, using public transportation or walking, biking, supporting renewable energy initiatives, and advocating for policy changes at the local, state, and national level. Climate change is having a significant impact on our health, both physical and mental. Increased heat waves, air pollution, waterborne illnesses, and the spread of disease-carrying insects are just a few examples of the physical health impacts of climate change. The trauma and stress caused by extreme weather events, loss of homes, and ways of life can have a lasting impact on mental health. Vulnerable populations are particularly at risk.